Hello and welcome back to Dr. Carri's Clinical Corner. Today we're going to talk about how often should I go pee. So normal is considered going to the bathroom every 2 to 4 hours during the day. And ideal, which I tell all my patients, I go more than this and I don't have a problem. It's not disruptive to my life, but in a perfect ideal world and body, textbook says you should only go 6 or 8 times in a 24-hour period. So like I said, I go more than that, but it's not disruptive to my life. So it's sort of like, these are the guidelines, the ideal. But what we go by is like, is it a problem in your life? And if so, then we address it. So I tell my clients like every 2 to 3 hours is normal. And at night, you should sleep through the night. Only a few circumstances like is it considered normal to wake up. So if you're over the age 65, it's normal to get up once in the night. My pregnant moms, you're probably going to get up and pee a lot in the night. And also if you have a newborn, because you're probably not sleeping as deep. So what are some things we can do? So if you're getting up a lot at night, I tell people, number one, we want to optimize the day first. So we want to try to get you to that 2 to 3 hour range during the day, and see if that improves your nighttime sleeping. And so that's number one. But number two, if it's only a nighttime problem and not a daytime problem, then it's probably not a pelvic floor issue, and it's probably more likely that it's a sleeping issue. So normally at night, what happens is our body produces this hormone called an anti-diuretic hormone, which makes it so we don't pee how we normally pee during the day. So a little anatomy biology. Urine is produced in the kidneys. So the kidneys kind of like filter out everything that's going through our bodies, and it creates urine, which is waste. And so normally the kidneys are always producing urine. The kidneys are up here, and there's like a ureter that goes to the bladder, and then the urethra is what we pee out of. So the kidneys are constantly producing urine and waste, and by drinking water, we keep them healthy, so it's not too concentrated of urine. So that's normally what happens. But at night, we produce what's called an anti-diuretic hormone so that kidney production slows down, so we're not getting up to pee. But if we're not getting into a deep sleep, then our body doesn't know to produce that hormone, and we might have to get up more often to pee. So that's why I tell my patients, like, let's optimize the daytime, but if you're still waking up at night, we got to look at other things. We got to look at if you have sleep apnea or a breathing problem, something like that. And then in the daytime, what do I do if I'm peeing too often? So try to make a habit to go on a regular basis is number one advice. So try to be consistent of going every 2 to 3 hours. I know some jobs that's hard if you are like a teacher or a nurse or maybe like a firefighter or police, right? Like you don't necessarily have access to a bathroom whenever you want. So some jobs make it harder, and you can only do what you can do. So I tell people, like, when you're not working, try to like work on that consistency during your non-working hours. And so that's number one advice. Number two is if you get an urge, take a deep breath, try to sit. Doing like 5 or 6 quick Kegels will kind of tell your bladder like it's not time to go yet. So that also, those strategies can be helpful. And that's sort of like the quick advice. And then if it's anything beyond that, you got to see a pelvic floor therapist. Maybe your pelvic floor muscles are too tight. Maybe you're not emptying completely. Maybe your pelvic floor muscles are weak. That's less common, to be honest, in my patients who have bladder urgency and frequency. It's pretty rare that they have weakness, but it's a possibility. But a lot of times there's no pelvic floor issue. It's these other things, right? It's I gotta work on my timing and not waiting too long. I gotta make sure I can empty my bladder completely. I gotta try to take some deep breaths and make it to the toilet. I gotta make sure I'm sleeping at night. So it's a lot of these other things. And because it's often not directly a pelvic floor issue, I created this online course that takes you in depth through all these things. So I will link that. There's a free introductory course that you can take to sort of learn a couple things to see if it helps and if it's on the right track. And if you like that, you can sign up for the full course, and it has like 30 plus videos and a bunch of modules to go through a bunch of different scenarios. So that is my advice for how often you should pee and what to do if you're going too often.